Guys, welcome back to the channel. If this is your first time here, guys, welcome here. And please make sure you subscribe, you like, you share, and very important, leave a comment. Tell me what you think about what I'm going to talk about now. Now, this is a reaction channel. We're peaceful. It's more like a fun channel. We're not here to fight. We're not here to argue. Anyway, guys, I did a live yesterday about the 200 babies that died at Jubilee Hospital, the disgraceful amount. And today, may I do a follow-up on it, because of course the Minister of Health respond to all the news that is going out, and he should be ashamed of himself, because now he's trying to justify why these poor people, I don't mean poor in feeling sorry for them, I mean poor financially, suffer so much carrying them kids for 9 months and lose the babies, and him have excuse to say why. Now, this ongoing tragedy at the Victoria Jubilee Hospital, it really exposed a lot of catastrophic failure of leadership, which can no longer be hidden under the rug. The planning and the resources management within the health system sucks. Now, the recent death of newborns, many of whom were born prematurely with low birth rate. But the fact that them born prematurely don't mean say them have to die. And it highlights this system, the deficiencies that are entirely preventable with proper investment and oversight. Remember, these are babies, man, never get a chance to survive. Instead of addressing these root causes, the health minister and the Ministry of Health are quick to shift blame onto the mothers, suggesting that their neglect or youth are primary factors, when in truth the failures lie squarely within the system's inability to provide adequate care. And this just cannot work. This is no flipping excuse. What they are coming up with is garbage. Blaming the mothers for their baby's death is not only irresponsible but reveals a disturbing lack of accountability. The fact that 55% of the infants who died were born prematurely, with 60% having low birth weight, underscores a profound failure in prenatal care. These are medical issues that should be mitigated through early intervention, proper monitoring, and access to specialized facilities, none of which are consistently available at Victoria Jubilee Hospital. Now, guys, if you just join the channel, or you just start watch the video, I'm talking about the 200 babies that died at the Jubilee Hospital, and talking about how the Minister of Health and the ministry putting the blame on the mothers. The ministries claim that resources shortage are beyond their control. It's a blatant evasion of responsibility. Hospitals are supposed to be equipped to handle high-risk pregnancies and support the most vulnerable newborns. Yet systemic neglect has left woefully unprepared. Those 200 babies that died at the Jubilee Hospital did not have to die. The statement that beyond the capacity of the system is no excuse. And what them talk in is bull. It's bull they're talking. Nonsense. And it's a bare minimum standard that any functioning healthcare system should meet. It is a moral imperative for the government to ensure that hospitals are adequately equipped with essential machinery such as incubators, ventilators, and diagnostic tools like portable X-ray machines. There's no excuse. Remember, it's pregnancy and babies you're dealing with. The absence of such basic equipment is a derelict. Guys, I am talking about this yesterday. I was very, very upset. And I am still upset because as a mother, I'm putting myself in the mother's place. How would I have felt? What would I have done if it was my child? I am telling you that something needs to be done. The absence of such basic equipment is a disgrace. And the fact that medical staff are resorting to improvisation, using flashlights to diagnose respiratory issues. Flashlight illustrates the depth of the crisis. This is not a matter of resource constraint. It is a matter of prioritization and accountability. The government's failure to invest in critical infrastructure is directly responsible for preventable neonatal deaths. Furthermore, the staffing shortage and poor nurse to patient ratio at Victoria Jubilee Hospital is terrible. The admission that ratio sometimes reach 1 nurse to 5 or even more babies is a damning indictment of systemic neglect. In cases like these where you're dealing with children, you can't have 1 nurse to 5 patients, 6 patients. What happens when they're dealing with 1 patient and the other patient need help? Such conditions are unacceptable, man. In any healthcare setting, especially one tasked with caring for fragile preterm infants. Overworked staff cannot perform their duties effectively, leading to missing diagnoses, inadequate monitoring, and compromised care. The government's inability or unwillingness to address staffing deficiencies demonstrate a profound disregard for patient safety and professional standards. And may I tell you, Jamaica health care system, as somebody said to me, the system had always been that way is because me never used to notice it. But if I saw it used to be, and you see one government going, the PNP blaming the JLP now. But they were there before. They could have fixed it too. They had the chance. So all this talk, this political talk, and this election time talk, it's just pure talk. Don't be fooled, Jamaican people, that there's going to be any quick fix for the healthcare system because it didn't take 10 years to get to this. It did not get 10 years to get to this, and I don't know how they're going to fix it, but they burst the thing, and the nasty, disgraceful thing is for now they turn around and blame the parents for the death of the children. The minister's comments about the need for significant resources to support preterm infants are a thinly veiled acknowledgement that the system is inadequate. Yet, instead of urgently mobilizing resources, the government appears content to dismiss the severity of the situation by making those flimsy excuses. The persistent lack of equipment, staff, and proper facilities is a direct consequence of mismanagement, corruption, and underfunding. These aren't just failures of logistics. They are failures of leadership and moral responsibilities. Babies are dying because policymakers have neglected their duty to protect most vulnerable, and this neglect must be called out in the strongest term. If you're just joining the video, thank you for joining. And let me just, because this video is a little lengthy, so let me go over and tell you what I'm talking about. I'm talking about the 200 babies that die at the Victoria Jubilee Hospital, and the fact that the Minister of Health is blaming the mothers when them no have no equipment, them understaff for take care of the baby them. And that is unacceptable. The excuse offered, such as ruling out bacterial outbreaks and equipment failures, are simply red herrings. The real causes are resources shortages, staffing deficits, and infrastructural neglect. They need to admit to that. The admission that labor shortages cannot be overlooked is a stark reflection of systemic failure. The government has known about these issues for years, yet little meaningful action has been taken to correct them. Instead, they continue to operate under a facade of competence, while vulnerable babies continue to die. Guys, this situation is a disgrace. It exposes a government that has failed in its most fundamental duty to safeguard the health and lives of its citizens, especially its most vulnerable. The systemic failures at Victoria Jubilee Hospital are not mere oversights. They are the direct result of negligence, mismanagement, and a lack of political will. The deaths of these newborns should serve as a wake-up call that urgent, comprehensive action is needed. Anything less is a moral failure and a betrayal of public trust. The government must be held accountable and forced to prioritize healthcare reform that ensures no babies die due to preventable systemic failures again. Guys, if you watch the video this far, thank you for watching. Make sure you comment. Tell me you have I'm sure say at some point in time there are babies born in your family. Even your friend baby, if you one stand up in the world and you don't have no family. So leave a comment, tell me what you think. You think say the government should be blaming the mothers, or should they equip the hospitals so that no baby should die who could have been saved? Guys, thank you for watching, and I will see you in my next video.